All right, let's now shift our attention to China as the deadly coronavirus continues to spread. The city of Wuhan has now shut down public transportation to halt the outbreak. The death toll due to the mysterious coronavirus has almost doubled in a span of a day, and a total of about 17 people are said to have been killed so far due to this outbreak. The Chinese city of nearly about 9 million people will temporarily shut down its public transportation. And those living in the city have also been advised to not leave it. The Chinese officials have said that all flights and passenger train services out of Wuhan will be stopped. The bus, subway and ferry services have also been temporarily halted. Meanwhile, a day after the discussions in Geneva, the World Health Organization's Emergency Committee is yet to decide on whether to declare a global emergency over the coronavirus outbreak. The panel has agreed that more information is needed about the spread of the virus. The Committee of Health Experts will again meet to discuss the further course of action. If declared a global emergency, then this will be the 6th international public health emergency to be declared in just the last 1 decade.
Today, there was an excellent discussion during committee meeting, but it was also clear that to proceed, we need more information. For that reason, I have decided to ask the emergency committee to meet again tomorrow to continue their discussion. And the chair, Dr. Sang, has agreed with that request. The decision about whether or not to declare a public health emergency of international concern is one I take extremely seriously, and one I'm only prepared to make with appropriate consideration of all the evidence.
Now, Hong Kong has also confirmed its first case of coronavirus. Chief Executive Carrie Lam ensured that told her people that Hong Kong had the protocols and the resources to deal with this mysterious infection. Meanwhile, airports in the United States, Australia and across Asia have begun extensive screening of passengers from Wuhan. The Russian airports have also strengthened sanitary and quarantine control. Passengers were inspected with thermal cameras as they arrived from China. Meanwhile, the National Institute of Health has said that the vaccine to combat the virus is presently underway.
Well, I think in order to discuss a vaccine for this new coronavirus, we have to go back several years to our experience with SARS. We actually did develop a vaccine for SARS. We got the sequence of the virus, and we used what's called a DNA platform, and we put it into what's called a phase 1 trial to determine safety and whether it induced an appropriate immune response. The phase 1 trial was successful, but we never had to further develop the vaccine because SARS essentially disappeared because of very good public health practices of isolation, identification, and quarantine. The question of developing a vaccine is not a major issue. We have already started, and we've partnered with a company that uses a messenger RNA vaccine platform, and we've already started the development of that vaccine. We anticipate that we would have the vaccine in humans in an early phase 1 trial for safety within about 3 months.
All right.